Hello, AP students. This is Mrs. Politsky, and I've got notes for Chapter 13. And we're going to talk a little bit about other medical therapies for psychological disorders. So, the modern day Phineas Gage. You remember Phineas? You know, the man who was working on the railroad who had the blasting iron shot through his skull? Okay? Lived to tell about it. Well, your book talks a little bit about the bullet in the brain cures a man of mental problems, which goes back about 30 years ago to February of 1988. A 19-year-old man was suffering severe obsessive compulsive disorder and had shot a .22 caliber bullet through the front of his brain in a suicide attempt. He did not die. He survived. And what was interesting is his pathological symptoms were gone after this event, and his intellectual capacity was not affected. Granted, this would not necessarily always be the outcome of such a scenario, but it did get psychologists interested in some of the things that could happen as far as manipulation of the brain. So let's talk about psychosurgery. Surgeons have long aspired to treat mental disorders by severing the connections between parts of the brain or removing small sections of the brain. Psychosurgery is the general term for the surgical intervention in the brain to treat psychological disorders. Psychosurgery has had a long history dating back to at least medieval times when surgeons might open the skull to remove the stone of folly. Prefrontal lobotomies. This was developed by a Portuguese psychiatrist named Igaz Muniz. He severed certain fibers, neurofibers, connecting the frontal lobes of the brain structure, especially those in the thalamus and hypothalamus. The original candidates for Moset's scalpel were agitated schizophrenic patients and patients who were compulsive or anxiety-ridden. This operation permanently destroyed the basic aspects of the patient's personality. A lobotomy usually produced an inability to plan ahead, an indifference to opinions of others, childlike actions, and the intellectual and emotional flatness of a person without a coherent sense of self. Psychosurgery is still occasionally done, but it is now much more limited to precise and proven procedures for specific brain disorders. In the split brain operation, the severing of the fibers of the corpus callosum can reduce life-threatening seizures in certain cases of epilepsy. Brain stimulation therapies. Electroconvulsive therapy, or the ECT, is a treatment used primarily for depression and involves the application of electrical currents to the head, producing a generalized seizure. Sometimes this is called a shock treatment. Used in patients who have not responded to drug treatment for depression. The electric current induces a convulsion by applying electric current of somewhere between 75 to 100 volts to a patient's temples briefly, kind of a 1/10 of a second as far as the duration. Patients are sedated with barbiturates and muscle relaxants. This renders them unconscious and minimizes the uncontrollable physical spasm during the seizure. Studies have shown that ECTs to be useful in treating depression, especially in patients with suicidal tendencies that demand an intervention that works more rapidly than medication or psychotherapy. Some critics of ECTs believe that the patients might be abused or abused to silence dissent or punishment for patients who have been uncooperative. Most worrisome are the memory deficits sometimes caused by the electroconvulsive therapy. Proponents claim, on the other hand, that the patients generally recover full memory functions within a month of the treatment. Another type of therapy is known as transcranial magnetic stimulations, or TMS, and this is a treatment that involves magnetic stimulation of specific regions of the brain. And unlike the ECTs, the TMSs do not produce a seizure. This involves directing high-powered magnetic stimulation to specific parts of the brain. Studies indicate that TMS may be useful in treating not only depression but also schizophrenia and bipolar disorder. Because most application of TMS therapy does not require the induction of a seizure, researchers hope that it will offer a safe alternative to ECT. Thank you very much.